Yeah, it's kind of reflective for me because it's been 5-6 years now since the approval of the TAG, the CD123 agent, the only one FDA approved in the US and now EMA approved for BPDCN. It's one of the great joys of my life and career to have been a part of that story, mainly just developing and putting this BPDCN field on the map. And so now, yeah, as I reflect, we wrote this article that you reference, TAG post 5-year approval. I think quite a few things have come out. One is that we know already from our early studies that it's a highly effective drug. 90+% response rates in the long-term setting, around 75–80%. In the frontline setting, a little bit lower in the relapse setting as you would expect in the more aggressive disease state. So that's really good. 2, there's been no new safety signals from our original New England Journal publication. We did a JCO follow-up paper 3 years later. So that's good to know that what we investigated initially is still what we're seeing now. And then 3rd, there is the one serious toxicity called the capillary leak syndrome, which we've reported on, published appropriately, a US FDA black box warning, that we've figured out how to deal with in terms of patient and provider education, expectations, prevention, monitoring, and even treatment of the syndrome if it occurs. And I'm really proud about that. That's education efforts by our colleagues in the pharmaceutical industry, academics, local community hospitals, our European colleagues. That's been a great story because I think with every new drug, there's a new toxicity often, and it's important to know what it is, speak about it, and incorporate it. So those are pretty exciting. We found that we were able to easily incorporate CNS prophylaxis, as I mentioned, stem cell transplant patients who are eligible, and finally we're working on post-TAG, post-transplant relapses, maintenance strategies, clinical trials. So it's an exciting time for our field in BPDCN because we really have had quite a few breakthroughs. So that's what the paper was about, and I hope people check it out.